Welcome to another video. This video includes 10 nursing practice questions to teach you how to master the NCLEX. At the end of the video, check out the description for studying resources and more. Practicing nursing questions frequently is the best way to pass many nursing exams. Now let's begin. Starting with question 1. In acute episodes of mania, lithium is effective in 12 weeks, but it may take up to 4 weeks, or even a few months, to treat symptoms fully. Sometimes an antipsychotic agent is prescribed during the first few days or weeks of an acute episode to manage severe behavioral excitement and acute psychotic symptoms. In addition to the lithium, which one of the following medications might the physician prescribe? Diazepam, haloperidol, sertraline, alprazolam. The correct answer is haloperidol. Haloperidol is an antipsychotic medication and may be used until the lithium takes effect. Which of the following findings would necessitate discontinuing an 4-potassium infusion in an adult with ketoacidosis? Urine output 22 ml per hour for 2 hours. Serum potassium level of 3.7. Small T wave of ECG. Serum glucose level of 180. The correct answer is urine output 22 ml per hour for 2 hours. Adequate renal flow of 30 ml per 4 hr is a necessity with potassium infusions because potassium is excreted renally. On a mother's second postpartum day after having a vaginal delivery, the RN is preparing to assess her perineum and anus as part of her daily assessment. The best position for the client to be placed in for this assessment is Sims, Fowler's, prone. Any position that the RN chooses. The correct answer is Sims. The Sims position is the best position for assessment of the perineum and anus. The top leg is placed over the bottom leg, and the RN raises the upper buttocks to fully expose the perineum and anus. Which of the following would differentiate acute from chronic respiratory acidosis in the assessment of the trauma client? Increased PaCO2, decreased PaO2, increased HCO3, decreased base excess. The correct answer is increased HCO3. Elevation of HCO3 is a compensatory mechanism in acidosis that occurs almost immediately, but it takes hours to show any effect and days to reach maximum compensation. Renal disease and diuretic therapy may impair the ability of the kidneys to compensate. In cleansing the perineal area around the site of catheter insertion, the nurse would wipe the catheter toward the urinary meatus. Wipe the catheter away from the urinary meatus. Apply a small amount of talcum powder after drying the perineal area. Gently insert the catheter another ½ inch after cleansing to prevent irritation from the balloon. The correct answer is wipe the catheter away from the urinary meatus. Wiping away from the urinary meatus would remove microorganisms from the point of insertion of the catheter, thereby decreasing the risk of bladder infection. A client was prescribed a major tranquilizer 2 months ago. 1 month ago she was placed on benztropine. What would indicate that benztropine therapy is effective? Smooth, coordinated voluntary movement. Tremors. Rigidity. Muscle weakness. The correct answer is smooth, coordinated voluntary movement. Benztropine is prescribed to decrease or alleviate extrapyramidal side effects of major tranquilizers. Smooth, coordinated voluntary movement indicates minimal extrapyramidal side effects. The physician prescribes phenytoin for a client with seizure disorders. Phenytoin can only be mixed with which of the following solutions? Ringer's lactate. D5 in water. D5 with Ringer's lactate. Normal saline. The correct answer is normal saline. Phenytoin is compatible only with normal saline and should be mixed only with normal saline for administration. A 9-month-old infant visits her pediatrician for a routine visit. A developmental assessment was initiated by the nurse. Which skill would cause the nurse to be concerned about the infant's developmental progression? She sits briefly alone with assistance. She creeps and crawls. She pulls herself to her feet with help. She stands while holding on to furniture. The correct answer is she sits briefly alone with assistance. The 9-month-old infant can sit alone for long periods. By the age of 6 months, many infants can pull themselves to a sitting position. A male client is experiencing extreme distress. He begins to pace up and down the corridor. What nursing intervention is appropriate when communicating with the pacing client? Ask him to sit down. Speak slowly and use short, simple sentences. Help him to recognize his anxiety. Walk with him as he paces. Increase the level of his supervision. The correct answer is walk with him as he paces. This gives support while he uses anxiety-generated energy. A 35-year-old prima gravida comes to the clinic for her first prenatal visit. The midwife, on examining the client, suspects that she is approximately 11 weeks pregnant. The pregnancy is positively confirmed by finding Chadwick's sign, fetal heart rate by ultrasound, enlargement of the uterus, breast tenderness and enlargement. The correct answer is fetal heart rate by ultrasound. Fetal heart rate movement observed on ultrasound is a positive diagnosis of pregnancy. Well, that's it with this video. See you next week for another set of questions. Leave a comment saying how many you got correct.